Welcome everyone! Today we're going to dive into something that can make a real difference in your certification exam success, understanding the different types of questions you'll encounter and how to approach them strategically. This isn't just about knowing the content, it's about understanding what the exam is actually asking you to do with that knowledge. By the end of this session, you'll have a clear understanding of Bloom's taxonomy and how it applies to certification questions. You'll be able to quickly identify what cognitive level a question is testing just by looking at its structure and wording. Most importantly, you'll walk away with specific strategies for tackling each type of question, which will not only improve your accuracy, but also help you manage your time more effectively during the exam. You might wonder why we're focusing on question analysis rather than just reviewing content. Here's the thing. Certification exams aren't just testing whether you've memorized facts. They're designed to evaluate different levels of cognitive ability, from basic recall all the way up to complex clinical decision-making. When you understand what cognitive level is being tested, you can adjust your approach accordingly. This awareness can significantly improve both your speed and accuracy on exam day. Bloom's taxonomy is our roadmap for understanding question complexity. Think of it as a ladder of thinking skills. At the bottom, we have remembering, simple recall of facts. As we climb up, we move through understanding, where we grasp the meaning, applying, where we use knowledge in real scenarios, analyzing, where we break down complex information, and evaluating, where we make clinical judgments. While the full taxonomy includes creating at the top, certification exams typically focus on the first 5 levels. Let's break down the anatomy of a typical certification question. Every question has a STEM. This is your clinical scenario or basic information. Then there's the lead-in, which is what the question is actually asking. You'll have your options, usually 3 to 4 possible answers depending on the exam. But here's the key. Watch for modifiers. Words like most, first, or except are crucial signals that tell you what cognitive level you're dealing with and how to approach the question. Remembering questions are your straightforward recall questions. These are testing whether you know basic facts, definitions, and terms. They're typically brief and direct. Which immunoglobulin crosses the placenta? There's no interpretation needed, just pure recall. While these might seem easy, they still make up 10 to 20% of most certification exams, so don't underestimate their importance. Here's a classic example. Normal weight loss for term neonates in the first week is... Notice how direct this is? There's one right answer based on a memorized fact. For these questions, your study strategy should include flashcards and spaced repetition. During the exam, answer these quickly. They're either you know it or you don't. Don't overthink them. Understanding questions go a step beyond recall. They're asking you to explain concepts, describe relationships, or interpret information. For example, the placenta functions as which type of filter isn't just asking what the placenta does, but asking you to understand and categorize its function. These questions test whether you truly grasp the underlying principles, not just memorized facts. Consider this example. Why does maternal hyperglycemia cause fetal hyperinsulinemia? This requires you to understand the physiological relationship between mother and fetus. To prepare for these, create concept maps and practice explaining processes in your own words. During the exam, look for questions asking about relationships, mechanisms, and the why behind clinical phenomena. Now we're getting into the meat of most certification exams. Application questions present you with a specific clinical scenario and ask you to apply your knowledge. A 2-day-old neonate presents with X. This finding indicates these questions make up 30 to 40% of most exams because they test whether you can actually use your knowledge in practice, not just recite it. Here's a typical application question. A neonate with acrocyanosis at 36 hours should be managed by... Notice you need to know what acrocyanosis is, understand its significance at 36 hours, and then apply that knowledge to determine appropriate management. Study for these with case studies and clinical scenarios. During the exam, first identify what knowledge area is being tested. then apply it to the specific case presented. Analysis questions require you to break down complex information and see relationships between different pieces of data. They often have longer stems with multiple data points. You might see something like, compare findings in conditions A and B, or questions that ask you to differentiate between similar conditions. In neonatology, there are many classic conditions and comparisons that you'll frequently be distinguishing between, like RDS and TTN, or omphalocele and gastroschisis. The key here is know what makes them different. These questions test your ability to think critically and make connections. Look at this example. A neonate with HC 90%, length 75%, weight 75% is classified as. This requires you to analyze multiple growth parameters and understand the relationships to classify the infant correctly. To prepare, practice compare-contrast exercises and relationship mapping. During the exam, organize the information systematically. Look for patterns and identify the connections between different findings. Evaluation questions are often the most challenging because they ask you to make clinical judgments. Look for phrases like best, most appropriate, or priority. These questions acknowledge that there might be multiple reasonable options, but you need to determine which is optimal based on the specific clinical scenario. These type of questions make up 20 to 30% of most certification exams. Here's an example. A neonate with PPHN not responding to current therapy would benefit most from. Notice how this requires you to evaluate multiple treatment options and prioritize based on the clinical situation. Study with decision trees and clinical guidelines. During the exam, consider factors like urgency, efficacy, and risk-benefit ratios when selecting your answer. Learning to recognize these signal phrases can help you quickly identify what type of question you're facing. Identify and list signal remembering questions. Explain why and describe indicate understanding. How would you use suggests application. Compare and differentiate point to analysis. And what is the best or prioritize indicate evaluation. Train yourself to spot these keywords. They're your roadmap to the right approach. Pay special attention to modifiers. They can completely change a question. Superlatives like most or best turn simple questions into evaluation questions. Time indicators like initial or first add a sequencing element. Negations like except or not flip the question entirely. And quantity indicators like most likely ask you to weigh probabilities. Missing these modifiers is one of the most common causes of incorrect answers. Let me share some common mistakes I see. Missing key modifiers, especially except or not, can lead you to choose the exact opposite of the correct answer. Another pitfall is answering what you think the question should ask rather than what it actually asks. Timing errors are common too. Choosing the right intervention, but at the wrong time in the clinical course. And there's the classic problem of overthinking simple questions while rushing through complex ones. We all have cognitive biases that can affect our test performance. Confirmation bias makes us look for evidence supporting what we already believe. Anchoring bias causes us to focus too heavily on the first piece of information we read. Recency bias gives more weight to material we just studied. And availability bias makes us choose familiar options even when they're not correct. Being aware of these biases is the first step to overcoming them through systematic question analysis. Here's your systematic approach. First, read the question twice before even looking at the options. This prevents bias. Identify all patient details and key clinical elements. Be crystal clear about what's being asked. Determine the cognitive level so you know how to approach it. Then, evaluate each option independently before making your selection. You can almost always rule out one option. And remember, if you must guess, do it strategically by selecting the most common clinical association. Exams rarely test rare exceptions. Understanding the typical distribution helps you allocate your study time effectively. Remembering and understanding questions make up about 20%, important but not the majority. Application questions at 35% and analysis at 30% together make up nearly 2/3 of most exams. Evaluation questions round out the remaining 15%. This tells you to focus your preparation on application and higher-level thinking, not just memorization. Let's see how the same content can be tested at different levels. Starting with remembering, what is the normal hematocrit for a term neonate? Simple recall. Understanding, why is the hematocrit higher in neonates than adults? Now we need to explain. Application, a 2-day-old with hematocrit 65%, is this normal? Analysis, compare expected values between term and preterm. Evaluation, hematocrit 70%. What's your priority action? Same topic, 5 different cognitive demands. Different content areas tend to favor different question types. Pathophysiology questions often focus on understanding and application. They want to know if you grasp disease processes. Pharmacology mixes straight recall with application scenarios. Clinical management heavily emphasizes analysis and evaluation. These are your complex decision-making questions. Professional issues tend toward understanding and application. Adjust your study approach based on the content area you're reviewing. Your study methods should match the cognitive level you're preparing for. For remembering and understanding, flashcards and concept maps work well. For application, immerse yourself in case studies and clinical scenarios. For analysis, practice comparison exercises and pattern recognition. For evaluation, work through decision-making scenarios and prioritization exercises. And here's a powerful technique. Create your own questions at different levels. If you can write a good evaluation question, you truly understand the material. Let's break down this question using our framework. First, notice how brief and direct this question is. The normal range for umbilical cord pH at delivery is, there's no clinical scenario, no patient presentation, just a straightforward request for factual information. This is your classic remembering question. Look at the structure. It's asking for a specific numerical value that you either know or you don't. There's no interpretation needed, no clinical judgment required. The key identifier here is that it's testing pure recall of a memorized fact. You can't reason your way to this answer. You need to have memorized that normal cord pH ranges from 7.2 to 7.4. For these questions, your strategy is simple. If you know it, answer quickly and move on. If you don't know it, make your best guess based on what you do know about normal pH values in the body. Then move on. Don't waste time trying to figure it out. These are the questions where flashcard preparation pays off. Now we've moved up to understanding. Notice the question asks occurs primarily because. It's asking you to explain the underlying mechanism of TTN, not just identify what it is. This is the hallmark of an understanding question. The structure gives it away. We're not asking what is TTN, which would be remembering, but rather, why does TTN happen? This requires you to comprehend the pathophysiology. You need to understand that during normal transition, fetal lung fluid is cleared through various mechanisms. And when this process is delayed, it leads to the clinical picture of TTN. Look at how all the options are explanations or mechanisms. Each describes a different pathophysiological process. To answer correctly, you can't just memorize a definition. You need to understand the relationship between retained lung fluid and the resulting tachypnea. This is why concept maps and explaining processes in your own words are crucial study strategies for understanding questions. This is a classic application question. Notice how we're presented with a specific clinical scenario, a 4-hour-old with multiple findings including hypothermia, tachycardia, tachypnea, and hypoglycemia. The question asks what you should do first. This is applying your knowledge to determine the priority intervention. The key identifier is that you're given a real clinical situation and asked to apply your knowledge to manage it. You need to recognize that while this infant has multiple issues, cold stress, possible sepsis, hypoglycemia, The critical value is the blood glucose of 38 milligrams per deciliter with neurological symptoms, jitteriness. This requires immediate intervention. To approach this question, you're not just recalling facts about hypoglycemia or understanding why it occurs. You're applying protocols for managing symptomatic hypoglycemia in a specific clinical context. You need to know that symptomatic hypoglycemia requires immediate IV dextrose, not just monitoring or addressing other issues first. This is why practicing with case scenarios during your study preparation is essential for application questions. This is an analysis question. Notice how you're given multiple data points that you need to break down and interpret together. The question presents 3 different growth parameters at different percentiles, and you need to analyze the relationships between them to reach a conclusion. The hallmark of an analysis question is that you can't just look at one piece of information in isolation. You need to compare the weight, 5th percentile, with the length, 25th percentile, and head circumference, 30th percentile. This pattern, where weight is disproportionately affected compared to length and head circumference, is characteristic of asymmetric IUGR. To approach this, you're analyzing patterns and relationships. You need to understand that in asymmetric IUGR, weight is affected first and most severely, brain-sparing effect, while in symmetric IUGR, all parameters would be proportionally reduced. This requires you to break down the information, see the relationships, and recognize the pattern. This is why practicing comparison exercises and pattern recognition is crucial for analysis questions. This is a complex evaluation question, the highest level we typically see on certification exams. Notice the phrase, most appropriate. This signals that you need to make a clinical judgment. There might be multiple reasonable options, but you need to evaluate which is the best choice given this specific scenario. Look at the amount of information provided: gestational age, current respiratory support, oxygen requirements, X-ray findings, age in hours, previous interventions, and blood gas results. You need to synthesize all of this to make a clinical decision. The blood gas shows respiratory acidosis, pH 7.28, PCO2 52, with hypoxemia despite significant CPAP support. To approach this evaluation question, you need to weigh multiple factors. Has CPAP been optimized? Yes, at 7 cm E-medical with rising FiO2. Is this surfactant deficiency? Less likely, at 72 hours with previous dose. Could this be infection? Possible, but immediate respiratory support takes priority. The key is recognizing that this infant has failed non-invasive support. Respiratory acidosis with hypoxemia on adequate CPAP indicates the need for mechanical ventilation. This is why studying clinical guidelines and decision trees is essential for evaluation questions. You need to be comfortable making priority decisions when multiple interventions might be reasonable, always considering what's most urgent and most likely to benefit the patient. Before we wrap up, I want to share a critical study strategy that will serve you well across all question types. As you're studying, you need to develop a radar for certain keywords that signal must-memorize content. When you see phrases like hallmark finding, classic presentation, pathognomonic for, classic triad, or associated with, stop and make a flashcard immediately. These are the exam writers telling you exactly what you need to memorize. Here's why this matters. These hallmark findings and associations appear at every cognitive level on certification exams, just dressed up differently. At level 1, you might see a straightforward question. What is the hallmark chest X-ray finding in RDS? Pure recall, and its low lung volumes, ground glass opacities, and air bronchograms in case you don't know. But that same piece of information might appear at level 3 as a preterm infant's chest X-ray shows ground glass opacities. What is your next intervention? Or at level 5, given these chest X-ray findings, which management strategy would be most appropriate? The key insight is this. If you haven't memorized that ground glass appearance equals RDS, you can't even begin to answer the higher level questions about management. The memorized association is your entry point to the question, regardless of what cognitive level is being tested. As you study, create a separate set of hallmark-finding flashcards. Every time your textbook, review course, or study guide uses words like classic, typical, or pathognomonic, that's your cue to memorize that association cold. Don't just understand it, memorize it to the point of automaticity. Think of these patterns as gifts from the exam writers. When they include a hallmark finding in a question, they're giving you a shortcut to identify what condition you're dealing with. But you can only unwrap that gift if you've done the memorization work up front. Once you recognize the pattern, you can quickly move to the real cognitive work the question is asking for, whether that's applying a treatment protocol, analyzing additional findings, or evaluating management options. Remember, these hallmark associations aren't just random facts. They're the diagnostic shortcuts that experienced clinicians use every day. Master them during your study prep, and you'll find yourself moving through questions more efficiently, with more time to focus on the complex clinical reasoning that higher-level questions demand. Let's crystallize what we've covered today. First and foremost, remember that question structure is your roadmap. It reveals exactly what cognitive demand is being placed on you. Once you can quickly identify whether a question is asking you to remember, understand, apply, analyze, or evaluate, you're already halfway to the correct answer. Each cognitive level requires a fundamentally different approach. You can't tackle an evaluation question the same way you'd approach a simple recall question. This is why so many test takers struggle. They're using the wrong tool for the job. It's like trying to perform surgery with a stethoscope. Strategic question analysis isn't just an academic exercise. It directly improves both your accuracy and speed. When you know what type of question you're facing, you can immediately apply the appropriate strategy. This saves precious time during the exam and reduces the mental fatigue that comes from constantly switching between different thinking modes without a plan. Here's something crucial. You must practice at all cognitive levels. I've seen too many nurses focus solely on memorizing facts, then struggle when faced with complex clinical scenarios. Your study plan should include activities that challenge you at every level of Bloom's taxonomy. Create flashcards for recall, yes, but also work through case studies, practice prioritization exercises, and analyze complex clinical situations. Finally, understanding Bloom's taxonomy isn't just about passing your certification exam, though it will certainly help with that. It's about developing a framework for lifelong learning in nursing. When you understand how knowledge builds from simple recall to complex evaluation, you become a more effective learner and ultimately, a better clinical nurse. So, as you prepare for your certification, remember, read the question structure, identify the cognitive level, apply the appropriate strategy, and practice at all levels. This systematic approach will transform how you approach not just the exam, but your ongoing professional development.